Hello, my name is Sara Hunt, and I'm here today to talk to you about the patient experience of the withdrawal of gene therapy for adrenoleukodystrophy and the reasons behind why the ALD patient community so desperately needs gene therapy in the UK. So, adrenoleukodystrophy, or ALD, is the most prevalent of a group of inherited neurodegenerative disorders called the leukodystrophies, which affect the white matter of the brain and spinal cord. It's an X-linked disorder, so most severely affects males, and there are several phenotypes affecting children and adults, the most severe of which is the cerebral form, which is thought to affect at least 45% of males with ALD and can develop in childhood or adulthood. Males with ALD are monitored for signs of disease progression in the brain via MRI scan at regular intervals from the age of 2. With an incidence of 1 in 15,000, we would expect to see about 40 babies a year born in England based on latest ONS birth statistics. In the UK, ALD is only treatable through bone marrow transplant following withdrawal of gene therapy in 2021. The most common route to diagnosis is through what I call the sacrificial lamb scenario. One member of a family, usually a child, presents with symptoms, and from this diagnosis, other family members are identified, and if male, monitored closely for signs of disease progression and potential life-saving treatment. Bone marrow transplant must be done within weeks due to the fact that symptoms continue to progress for approximately 6 months before halting, with the transplant itself often speeding up these symptoms. Therefore, timely treatment is imperative for successful outcomes. A good example of this is my own family's story. My oldest son, Alex, presented a very typical disease course at age 7, having previously been healthy with no concerns. Following uncharacteristic behaviours and temper tantrums, declining schoolwork, bouts of clumsiness, falling and confusion, he was diagnosed with ALD in January 2001. By June, he was completely dependent, tube-fed, and could not communicate, dying at age 19 in 2012. His brother Aidan was also diagnosed and monitored regularly from the age of 2. When he was 8, changes were detected by MRI scan, and he had a successful bone marrow transplant within 4 weeks of his scan. He is now 23, leading an active and fulfilling life, working full-time, and with no visible signs of his condition. We consider ourselves incredibly fortunate, not least because he only had one donor in the entire world due to a rare blood type. Had anything gone wrong, this could be a very different story. As you can see, the benefits of gene therapy are significant. And while we appreciate that we don't yet know the very long-term effects of gene therapy, we do know that patients with cerebral ALD will die if they cannot have a bone marrow transplant in time. The Alex TLC database holds records of 20 boys who underwent timely transplants. The majority of these transplants had very successful outcomes. However, sadly, 2 of these boys died from transplant complications. We also hold records for 8 boys who were transplanted too late for a variety of reasons. Of these, 3 have now died, and the others have varying degrees of physical and cognitive disability. And I'd now like to share some individual stories which I hope will illustrate these benefits. So this is Christopher. All the signs were there for a successful treatment after ALD changes were detected. Sadly, Christopher developed graft versus host disease and died. He was 9 years old. One of the first families that we supported was an Afro-Asian family. Their story really highlights the health inequalities determined by ethnicity when identifying matches for bone marrow transplant. Their mum came to us in a very distressed state. Her eldest son, Omar, was already symptomatic. Excuse me. And doctors had just established changes in her younger son's MRI scan. Hamza desperately needed a transplant, but no donor was available. and the parents were not suitable for haploidentical donation. So this poor mum had to watch her younger son deteriorate in the same way as Omar, and both boys later died. She has another son with ALD, who to date has not displayed cerebral symptoms but remains under constant medical surveillance. Cameron is the son of our support services manager, Karen. His twin brother, Alex, was diagnosed at age 6, too late for treatment. Cameron was immediately scanned and identified as needing urgent transplant. Due to the urgency required, his father was used for a haploidentical donation, which sadly failed. The hospital quickly identified a local unrelated donor who devastatingly pulled out at the last minute. As a last resort, doctors tried a second transplant from Dad, which was successful. Unfortunately, by this time it was too late, and Cameron's symptoms continued to progress. He is now a fully dependent 27-year-old man, tube-fed and with limited communication, but the most wonderful laugh. This is JJ and Zaki. The boy's uncle was diagnosed with untreatable adult cerebral ALD in his early 20s in 2016. JJ was identified for urgent transplant a month later, which sadly did not halt disease progression, and he became completely dependent, dying earlier this year. Zaki was later identified as needing a bone marrow transplant at age 3. At the time, Great Ormond Street were involved in a long-term gene therapy study for ALD boys. Due to the devastating consequence of the bone marrow transplant for JJ, the family were terrified that Zaki might have a similar outcome, and so chose gene therapy for him. The treatment was very successful, and Zaki is now 8 with no visible symptoms and enjoying his childhood. When Bluebird Bio announced the withdrawal of ALD gene therapy in the UK and Europe in 2021, it was a bitter blow for our community, especially when FDA approval was announced the following year. Although Alex TLC has not heard of any patient that may have needed the option of this life-saving treatment in the past 2 years, that doesn't mean there haven't been any, and it doesn't mean there won't be any in the future. So if a patient is identified that needs gene therapy for one of the reasons I've illustrated, what will happen? Will there be funding and help for that poor family to get to the States and access this treatment? Will the patient be well enough to endure the flight? Will the parents be able to uproot themselves, leave their responsibilities, jobs, other children? Or will the powers that be just leave these families to suffer the very avoidable loss of their son? In conclusion, at the moment, the instances where gene therapy may be a life-saving alternative to bone marrow transplant are not huge. There won't be many patients, maybe not even one a year. But having gene therapy available in the UK will address the health inequalities currently faced by ALD patients needing a transplant. I also need to point out just how unfair it feels that gene therapy has now been approved for MLD in the NHS, and with quite a media fanfare. And finally, as with other countries across the world, I think it is prudent to assume that at some point soon, newborn screening for ALD will be available in the UK, and that it is one of the conditions on the recently announced list for the Generation study. This will identify more patients who will be eligible for treatment and more opportunities for positive outcomes. It also indicates there will be more potential for negative outcomes, and therefore a more urgent need for the option of gene therapy. Alex TLC would urge you to think about this future. Thank you very much for your time, and so sorry I couldn't be with you today.